Welcome to today's webinar presented by Native Connections. It is on gathering your community readiness score. This is the information about the Native Connections Center. We've got a phone number, a website, and information for you to contact Deborah Rattler, the director. The webinar we're presenting today is part one of a series that is about the Community Readiness Assessment process. And there are upcoming webinars that are part of this series as well. This is a list of them. And the next one that's coming up is December 17th, and the series will continue into January. Our hosts today, my name is Sarah Peterson. I'm a digital media specialist who works with the Native Connections Project. Also here with me is Josephine Keefe, who is a Native Connections coordinator. Our presenters today are Iris Prettypaint, who is the Native Connections task lead, and Deborah Rattler, the Native Connections director. We've also got other Native Connections coordinators on the line, and they'll have an opportunity to introduce themselves to you later. Right now, I'd like to turn it over to Deborah Rattler.
Hello, this is Deborah Rattler, the Native Connections Director. I'm Grobant from North Central Montana, and I'm also a coordinator. I'll talk about that a little bit later. Today, our agenda for the Native Connections program is the first webinar in our series. We're going to be going over some of our learning objectives, the theoretical foundations and purpose, and the community readiness process. We'll go over the community readiness dimensions and the stages of readiness and what the next steps will be in this process. Our learning objectives for today will be to describe the theoretical foundation and purpose of the community readiness model. We're going to explain the step-by-step process of conducting a community readiness assessment. We'll be identifying the dimensions and talking about the stages of the community readiness model. For the Native Connections program, our goals are to prevent and reduce suicidal behavior and substance abuse among our American Indian and Alaska Native young people up to and including age 24. We're working to reduce the impact of substance abuse, mental illness, and trauma on our communities through a public health approach. This will allow our communities to support our youth and young adults as they transition into adulthood by facilitating coordination among our agencies. The approach that we're going to be using is going to be a virtual approach. This is all based on a public health model and will be community-based planning. We're going to be providing training and technical assistance on community readiness assessments, strategic action plans, service delivery systems, and other grant activities that we'll talk about later. Where this will be to engage our community stakeholders, our leaders, and our Native youth. And this approach will also include virtual reporting and evaluation. Up here, you can see our Native Connections map. You can see in Alaska and the lower 48 just how spread out all of our tribes are. And so it's going to be pretty interesting just keeping up with everybody on the map. Our activities this first year for the grantees will be to hire your staff to start involving the community in this process, conducting your community readiness assessment. You're also going to be working on developing your policies and procedures and some standards of care for your youth. We're going to be working on effective transitions between care and including the role of traditional healing in this process. On this slide here, I have just who all of the staff is that you're going to be working with this year. I'm Deborah Rattler. I'm up on the top left-hand corner. Next to me, we have Josephine Keefe, who is one of the Native Connections coordinators, Connie O'Mara, who's also a Native Connections coordinator, and Gary Newman, a Native Connections coordinator. At the bottom left-hand side, we have Iris Pretty Paint, our subject matter expert, Iceland Rio, who will be working with us on evaluation and reporting, and then Sarah Peterson, our digital media specialist. So one of the things that with the Native Connections coordinators is that we are all going to be assigned to 5 different tribes or grantees. And so here's my picture. And as I said, I am Grovant from north central Montana. And the grantees that I'm assigned to will be the Confederated Bands and Tribes of Yakima Nation, the Mescalero Apache Tribe, Turtle Mountain Band of Chippewa Indians, Selawik IRA Council, the Yukon Kuskokwim Health Corporation.
Good morning and good afternoon to those on the East Coast. My name is Josephine Keefe. I am the Native Connections Coordinator. I am a member of the Nez Perce Tribe, and I'm based out of Spokane, Washington. The 5 grantees that I have been assigned are the Muskogee Creek Nation, Confederated Tribes of the Colville Reservation, Seneca Nation of Indians, the Shingle Springs Band of Miwok Indians, and Alaska Native Tribal Health Consortium.
Good morning and good afternoon, everybody. My name is Connie O'Mara. I'm a member of the Citizen Potawatomi Nation from Shawnee, Oklahoma. I'm a TTA coordinator for the Tribal TTA Center. I'm located in Albuquerque, New Mexico. And my communities include the Osage Nation, Pueblo of Nambe, Round Valley Indian Health Center, the Standing Rock Sioux Tribe, and the Manolik Association. Thank you.
Gary, if you're on the line, please press *6 to unmute yourself so you can introduce yourself and your communities. Sounds like, Gary, are you there?
Hello, this is Gary. Can you hear me?
Yes, perfect. Go ahead.
Thank you. Greetings. This is Gary Newman, and I am located in Evero, Montana, on the Flathead Reservation. And the communities that I have are the Kickapoo Tribe in Kansas, the Menominee Indian Tribe of Wisconsin, Santo Domingo Tribe, and Asakarsamiut, and I apologize if I got the pronunciation wrong, Tribal Council, and the Tanana Chiefs Conference.
Okay. As we continue on here, the Cohort 1 grantee pairings are on this slide, and part of this grant was to pair up each of the grantees with another one for mentoring and to work with each other through this process. So our first pair is the Osage Nation and the Muskogee Nation. The second pair is the Confederate Tribes of the Colville Reservation and the Confederate Tribes and Bands of the Yakima Nation. Our third pair is the Mescalero Apache Tribe and the Kickapoo Tribe in Kansas. The fourth pair is the Seneca Nation of Indians and the Menominee Indian Tribe of Wisconsin. Our fifth pair, the Santo Domingo Tribe and Pueblo of Nambe. Pair 6 is Round Valley Indian Health Center and the Shingle Springs Band of Miwok Indians. Pair 7, the Turtle Mountain Band of Chippewa Indians and the Standing Rock Sioux Tribe. Pair 8 is the Alaska Native Tribal Health Consortium and the Escarcement Tribal Council. Pair 9, Selawik IRA Council and the Dene Hinash Tanana Chiefs Conference. Pair 10, the Yukon Kuskokwim Health Corporation and the Manolik Association. And I want to turn this over to Iris right now.
Thank you, Deborah. Good morning, everyone. My name is Iris Pretty Paint, and I serve as I have a couple of different roles, but I serve as the task lead for Native Connections, and also the subject matter experts for the Tribal TTA Center. And with that, one of the roles that I have is to help you today to introduce you to the Community Readiness Assessment model. And in doing so, I'd like to just say a little bit about, where it comes from. Several years ago, under a project called Native Aspiration, we used this model with 65 tribes across the U.S., and in fact, some of you today may have worked on that project with us. But this model is over 20 years old. Community Readiness Assessment came into Indian country in a unique way, and it was adapted, and things were changed around, for our communities. And I have a quote here today that I want to share with you from Gordon Tutusis, a member of the Cree Nation from Poundmaker Reserve. And Gordon has crossed over to the other side, but before he did lots of work with tribal nations, First Nations, and one of the things that he talked about was getting ready for change. And in doing so, he recognized that, it's challenging to be able to work in our communities and to get people to come together and to be able to look at things that our young people face. And so his quote today for me sort of captures the opportunity that we have today to deal with the issue of suicide. And there's no better time than today for us to work together. And thank you for all the introductions for the coordinators. I can't tell you how fortunate you are today to have this level and caliber of people that are positioned to reach out to you today to support you in the work that you have to do in your project and in your community. And one of the tools, the very first tool that we will be doing is helping you to complete a community readiness assessment, meaning that we will help you to go through the process, to learn the process, and to actually conduct your own readiness assessment. Probably one of the greatest lessons that we've learned in the community readiness assessment process is that we've come to understand a gap that we have in the development of prevention in our communities, is that we do a lot of work for the readiness of the staff, and we do all kinds of activities and interventions in our community, but we're developing those at the level of readiness that we have as prevention workers and as advocates and individuals in our communities. And this tool is designed to help you to measure the readiness of the community and to design those interventions, those strategies that best match your community, where you're from, and being able to use those resources that you have and align those with the level that you score in so that you're able to make the best use of the resources that you've been provided. So today I just want to give you a very, very brief and quick overview of where this model, the foundation of it. And of course, many of you may be familiar with this, but there's three areas that the Community Readiness Assessment model has drawn from, and those are three theoretical areas. This is one model that has been tested many times. It's used internationally. It's been customized for different issues, and today we have it customized for suicide prevention. And so with that, the one area, the first area that it draws from is a group of researchers that were in the field of alcoholism. And what they wanted to understand was the process that someone would go through to be able to deal with the issues of smoking or drinking or, whatever the issue might be. And what they drew from for this model are those 5 stages of treatment readiness. So we know that people, will begin at a process of contemplating if they want change. They'll have conversations and begin to talk about who's responsible for different issues that are occurring in our community and who would like to be able to take the lead on things. So those 5 stages that come into this model, and we'll go back over these many times with you so that they're helpful to you. But you have pre-contemplation, contemplation, preparation, action, and maintenance. And so the work of Prochaska and Di Clemente is very important into understanding when you get into talking about the stages of denial, the lack of awareness, no awareness at all. And the second area that this model draws from is how do people go about making decisions? What process do they have for being able to recall information that they're learning? What is it about suicide or substance abuse, that people are comprehending about the messages of prevention? And as far as what skills do they have to be able to use that knowledge? So a lot of times you'll hear people not really knowing how to make a decision once they get the knowledge. And so the old saying about, well, does it matter if you have the knowledge if you still don't make a decision? Well, by not doing anything about suicide, that's a decision. And things flow out from that. So I always like to, when I do this training for tribal people, I try to remind them of the historical trauma and that how important it is to understand that the skills that you lose when you come from an oppressed community is the ability to plan. And part of that planning is making decisions. And so this model allows us to bring some of that knowledge forward. And by bringing that forward, we're able to talk clearly about communication. We're able to talk about how long it's going to take us to do something. And because we live in communities and families, we're able to talk about systems. And so being able to take action, being able to create a plan that will help you to talk to other people to make a decision about these topics, So there's really a wealth of information that is incorporated into this model. And our responsibility and our honor today is to be able to share that knowledge with you through our team and to help you to get ready to learn how to do a community readiness assessment for your community. And then, as we get down to the end of this year, we'll come back and help you do a post-assessment so that you're able to see where this tool can help you establish a baseline and then come back and learn, the process that you've been through. So over the next 6-part series, we're going to be talking about this model, and we've taken it and put it on a circle. I don't know why we always think better when we can think in a circle, but if you look at this circle and you enter it from the east and you go clockwise, that's exactly the way this model flows. And our goal is to be able to introduce you to the outside circle, the process that you'll go through, your ability to be able to understand the stage that you score in, so you know that those interventions that align in that stage will help you decide the inside circle, which are the dimensions to the model, and you'll be able to ask. So we're going to test out some of those questions with you today so you get an idea of, why do we interview people so that we can gather information across the community. So thank you so much for joining us today. I look forward to being on calls with you, and I'll turn this over to Josephine. Thank you so much.
Thank you, Iris. So with that diagram in mind, we'll move forward on just asking the question, what exactly is the Community Readiness Assessment Model? And the Community Readiness Assessment Model, or CRA as it's commonly referred to, is a systematic approach designed to support a community through mobilization and ultimately change. The model measures 6 dimensions of a community or aspects of that community. Those 6 dimensions are community efforts, community knowledge of those efforts, leadership, community climate, community knowledge about the issue, and resources related to the issue, which Deborah Rattler will go into greater detail on each of the 6 dimensions shortly. Within each dimension that I mentioned, there are 9 stages of readiness, and this can sometimes be a source of confusion when first understanding how the model is created. It's important that when you refer back to that diagram that Iris was referring to, that circle, it's important to always view the Community Readiness Assessment Model in a multifaceted way, in 3D, and with multiple layers which are all working simultaneously. And with each of those 9 stages of readiness, each readiness stage has specific interventions that work most effectively for that specific stage. The Community Readiness Assessment, it also integrates culture into the prevention process. Now, this is important because without that, a community might feel detached from the model. But when a community is able to integrate their set of beliefs and their own cultural identity into the CRA, the community is able to make the model uniquely their own. A community is then able, with implementing a community needs to be ready for mobilization and ultimately change. So a community's readiness is essential and the driving force for lasting success. And now I'll turn it over to Deborah, who is going to describe in greater detail the 6 dimensions of the Community Readiness Assessment Model.
Okay, what we're going to go through these 6 dimensions. These are for stages of readiness. Your first stage is community efforts. And on this stage, we're looking at, what's happening in your community already. What programs do you have that address suicide prevention? Are there policies in place that, provide some direction on suicide prevention? The next dimension is community knowledge of efforts. You have to think about, what do your community members know about what you're doing in suicide prevention? Do they know if these programs are working, if they're not working? Are they effective for them if they need them? And do all people in your community, do they all know about what's happening with suicide prevention?
Deborah, I just want to note that some people are having trouble speaking, so everyone who's presenting, please make sure to speak up.
Okay. The next dimension is the leadership. And when we're talking about leadership, we're talking about not just the tribal council leadership, but every community has different forms of leadership. Some of these are traditional leadership, spiritual people, just natural community people that, come to the front, and take a leadership role on trying to get something done. And these are usually people that are pretty influential over the community, and they do have a lot of community support. The community climate, what's the attitude in your community about suicide prevention? Is it one of people just feeling like, I don't know what to do? Or is it one of responsibility and taking, empowering, I know what to do, I know how to help. So, understanding where your community climate is understanding where your community is standing, what your community members are feeling. community knowledge about the issue? Do your community members, do they know about suicide prevention? If you do have programs available, do they know how to access them? If you do have suicide prevention programs that are happening now, how are they running? What are their impacts to your community? Are they working? Are they not working? Resources related to the issue? What's happening locally? Who's supporting suicide prevention? What people are involved? Is there time set aside for, what's happening? Where are these, programs and happening in your community?
We're going to have a polling question now for the audience members. Give me just a moment to open it up here for you. The question is, based on your knowledge, does the community know about efforts for suicide prevention and treatment of mental health? People who are watching, you can go ahead and click the option that is most reflective of your knowledge of your own community, and in a moment, we'll broadcast the results.
Okay, up here we have the results of our first polling question, and it's changing. It was 50-50, and now it looks like, yes, my community does know. 38 of the communities, feel that they do know what's going on about suicide prevention and treatment of mental health. And then our community, there are about 62% of the communities that don't know. So this is what, we're looking at changing so that through this grant process, all of your communities will know about what to do. What I want to talk about a little bit next is the stages of community readiness. And when we do get to the stages of community readiness, this will be after we've done the interviews, after we've scored all the interviews, and each grantee will have a specific score. One thing about these scores is that there's no good score, there's no bad score. These are going to be just some place for us to start. And that's one of the things I think that I really like about this whole process is that we need some place to start, and this is, what we're going to work from. So I'm going to go through all 9 stages just to give a brief overview of each one. So on stage 1, in no awareness, some communities, aren't looking at suicide prevention. They're not looking at suicide at all, or suicide may not be recognized in the community as a concern yet. On stage 2, denial and resistance, maybe there's a feeling in your community that nothing's being done right now. Not very many people really know what's happening, or there's no recognition locally about what is happening. In stage 3, some people in the community feel that this is just a local concern. Something has to be done about it, but we just don't know what to do, or there's no motivation to do anything. Stage 4 in pre-planning. Now the community's members are starting to have a recognition that this is a problem. It's happening here in our community, and we need to do something about this. But again, it's people discussing this, and there's no real planning yet. In stage 5, now people are starting to plan. Something's starting to come together, and they're starting to focus on the details of suicide prevention. You've got leadership involved. People are starting to come together on this and want to do something. In stage 6, initiation, now there's going to be information available that will justify what you're doing. Programs are happening. People are getting involved. Action's starting to move along. but this is still a new effort. Maybe at this point, staff are being trained in suicide prevention. Stage 7. This here is where communities have a few efforts that are already running. They're working. Their efforts are being made by, your leadership, the people in the community, that, this is an effort that we want to support. Programs that you're doing or activities, strategies, they're pretty stable and people are starting to know what they are and how to access them. In stage 8, your confirmation or expansion, this here is where your efforts are starting to be evaluated, and they're starting to really come together as a reflection of your community. And this is what, we're all going to be working towards, is that each one of these efforts, when you get to this stage, is specifically done for your community. This is where you're going to start really getting ideas for new efforts, new ideas, new activities, and those will be developed. And as you move through this stage, you're going to see that there's going to be more resources out there that will help you. Stage 9, this here is where your community is going to be pretty sophisticated about what you're doing for suicide prevention. Your staff is going to be really well trained. They're going to be cross-trained. They're going to know, the mental health and other risk factors. They're going to know how to deal with those. Your leadership is going to be really high on this. They're going to be involved in this. This is something that, your community is going to be moving forward with. Your involvement of your community members. You'll have a lot of community members saying, yes, this is a problem, we're dealing with it, and this is what we're doing. And your community is going to be holding, your programs accountable to meet their needs. So these are the 9 stages, and we're going to be working with you through each one of these.
And here's a second question for the audience members today. The question is, do people in your community use mental health treatment services? You can answer by clicking the yes or the no or don't know, and we'll broadcast the answers in just a moment.
Okay, this is, when you look at the results on this one here, it looks like 68% in your communities do know how to use, are using your mental health treatment services. And then we also have about 10% that don't know how to use the treatment services, or maybe they don't know how to access those. And then I think a number of you, about 23%, don't know right now, if your community are using these services.
And a comment from the chat box from Stephen DeKai is, not all that need mental health services use them. So I guess no answer is not giving a clear picture. That's true, and this is definitely a question like this would only be one small part of a wider assessment. And now I'll just briefly take everyone through the step-by-step process and a very brief overview of what those are. The first one is identifying the issue. And by acknowledging that there is an issue, you are acknowledging its existence within your community. And by doing so, you're taking that first step in identifying it and naming that issue. The second part is defining the community, and that can be through a number of different ways, but it's a step that helps bring layers to your community's profile and makeup. For instance, what are the demographics of your community? What's the male to female ratio, the age ratio? What is it an urban or rural setting that your community finds itself in? These are just a few examples of questions that can help define your community in greater detail. The third part is to conduct the key respondent interviews. This is the community's big step forward in getting out and assessing its readiness firsthand. The fourth is the score to determine the readiness level. By scoring and determining a community's readiness level, they are also able to determine in greater detail the issue the community faces. Number 5 is developing the strategies. Based off of the key respondent interviews and the scoring to determine its readiness, the community is able to then develop a comprehensive strategy to suit their unique needs for tackling the issue at hand, which is very essential within this process. And number 6, which we all want to see, is creating the community change. After the community has mobilized during the steps 1 through 5, they're ready to create the positive change envisioned for their community. And I'll turn that back over to Deborah, and she will take you through some next steps.
Okay, what we're going to be looking at next is that we have a community readiness manual, and we're going to be sending that out to you real soon in the next day or two. I've also included in here this book, To Live to See the Great Day That Dawns. I'd really encourage you to access this book if you don't already have it. It's a book that's free. It's up, through SAMHSA, and this here lays the groundwork for suicide prevention. And it also talks about the Community Readiness Assessment and some other things. And then also we have some free suicide prevention training. The Suicide Prevention Resource Center does offer these free trainings. And I'd really recommend that you go online and that you do, look at these two that we have up here, a strategic planning approach to suicide prevention, and then locating and understanding data for suicide prevention. And I think if you go through these, read these, it's going to help you as we move through the assessment portion.
Now is our period for questions and answers. So if you have questions or comments for any of the presenters today, or comments on any of the issues that were brought up, you can share them now. And you can do that by pressing *6 on your phone. That'll unmute the line and you'll be able to ask the question. Or you can type a question or a comment in the chat box in the bottom right-hand corner. We've already had some good comments there about different elements of nuance having to do with whether and how people access different types of services in a community. So are there questions today? There are some folks typing in the chat box. We'll give them a second to get their questions in. And remember, you can also press *6 and ask your question over the phone. The first question is from Shauna from Canada Chiefs Conference, asking, how do we work with our communities and behavioral health department to build a bridge of trust so our people are comfortable getting services? Deborah or Iris, can you speak to that?
I'm sorry, Sarah, could you repeat the question?
Yeah, and it's written down in the right-hand corner as well. The question is, how do we work with our communities and behavioral health department to build a bridge of trust so that our people are comfortable getting services?
So, can I offer ideas like the other tribes?
Sure.
Hi, I'm Patty Brisley. I'm from the Seneca Nation, and I apologize for being a few minutes late, but I've been working with our community as a prevention specialist for the last 3 years. Something that helped me build trust with the youth and with parents and the elders and even other departments. Our youth group put on monthly community dinners and socials. Socials always draw people in, and them getting to know you as a staff and what your goal is. I think that worked really great, and we continue to do that to this day. That might be something to having like a neutral event to introduce staff, who's available, who's where, that kind of thing. I don't know if that's the kind of question she was asking how if they'd be able to do that in their community. But
thank you for sharing that. There's a second question from Ardina Orozco. Will we be given a timeline for the CRA for each community?
Well, let me respond to that. I'm not sure what is. Is there any way that Ardina can speak? Can you unmute her line?
Ardina, if you'd like to speak, if you could press *6 to unmute your line, you'll be able to talk with Iris. Great.
Yes, I'm here. Hi, Ardina. Hi, Iris. Hi. Can I ask you what you mean by a timeline?
Is there to complete the CRA? Will you be helping us because I know there's the things we need to do inside of our Native Connections grant, but is there a specific date that the Native Connections want us to have it completed by?
Yeah, we have a schedule. We have a webinar schedule. We're going to start the actual process on December 17th. And what we'd like to do is we'd like to have you start your questions and select the individuals that you will interview, and then give you time to work with your coordinators to begin the scoring. So you potentially could get your score by the end of January. And I know you've been through this before, but the sooner you get that score, then the quicker you can move toward applying that to your plan and selecting your intervention. And so that's the process we have right now. If you decide that you want to move quicker, then that process, where your coordinator is going to be in the position to help you to do that. So you don't have to wait until, the webinar. But we'd like to be able to help you understand, the selection of the people that you interview. And so I think I understand what you mean by the timeline. So if we could get all of the Native Connection grantees to be in a position to complete their scoring by the end of January, I think that would be very helpful to your process in this year one.
Okay, yep, that helps me very much. Thank you.
Are there other questions today? I see that some people are typing right now to answer questions, and I also see that Shauna thanked the previous speaker for the example and shared some more information about the 42 communities that she's working with.
Hello? Hello? Oh, hi. This is Catherine Soluskin from the Yakama Nation. How many interviewees do we need to have completed? What's a good number?
Well, it ranges between 6 to 8 interviews, and, we want to have the opportunity to talk with you about that because in many of our communities, we have smaller communities that are on our reservations or in our villages, and we want to make sure that we're in a position to help you decide, do you want a representation of the entire community, or would you like to do a targeted part of the community? So the tool is designed for 6 to 8 interviews, and you're able to determine your score based on that number of interviews. People have done more, but they have also ended up with the same score if they would have done 6 to 8. Now, if you drop below that number, I wouldn't recommend just interviewing 3 people because I don't think you get a really clear reading for your community. But that's the range that the model recommends, is between 6 to 8 interviews.
There's a question in the chat box from Ann, Mark, and Bernie from the Yukon Kuskokwim Health Center in Bethel. They ask, will there be scheduled calls with our project officer?
And I'm sure that Deborah can answer this, but, on the grantee orientation webinar, they assigned Angela, and if Angela's on the line, I wonder if you'd like to respond to her question. Angela, are you there? Angela?
Oh, hi, it's Angela. Can you hear me?
We have a question for the project officer for Yukon Kuskokwim.
Yes, this is Angela, and Michelle and I are actually in the process of getting those scheduled. We're working on that with Iris and the rest of the TA team. So we are hoping to have calls starting to be scheduled in the next few weeks, if not January at the latest.
Thanks, Angela.
You're welcome.
Another question from Lisa Ilana from Manilac is, are we allowed to provide incentives for interviewees?
Mm-hmm.
Yes, we have in the past provided honorarium, and when we get into the details of the process, it's very important to separate the people that you interview with the people that do the scoring, so that we would have honorariums for the people that we would interview, and then we would also provide an honorarium for the people that come and do the scoring of the interviews. If you have people do the same, then they will influence the scoring based on how they completed the interview. So that's the only recommendation I have, is to be able to have resources, and we can give you a different sample of how other communities did it. Sometimes it depended on the community on what they felt was an appropriate incentive. Sometimes they bought gifts or they gave gift cards, but it was always a part of the process, and people understood. They also, wanted to make sure that there was, the aspect of confidentiality was involved in it. So, we'll go through that with you. But yes, it's up to the community on what you decide. But it always worked for us to be able to compensate people for helping us to be able to implement this tool.
A follow-up question from Lisa is, what is the maximum honorarium amount?
We can't give honorarium.
Well, I don't want to give you a maximum, but I know that in Native Aspirations we never, actually it's Connie or Gary's on the line. Connie, do you remember our honorarium for the interviews? Was it 25 or was it 50?
That's correct, Iris. It's around $25, I believe.
Okay.
Yeah, this is Angela also. I know that we also offer that where you could do gift cards. And I know it's no more than 25, but I know that just recently they changed some of the guidelines as to where the gift cards would be.
Okay, so we'll need to get that information for the grantees, and we can share that on maybe our next webinar.
Yes, I'll work on that.
Okay. Good question.
This is Bernie Siegel in Bethel, Alaska. It's more of a comment than a question. That is, we're working in rural, remote communities, and our time is involved with communities where English is a second language. And so we have to be concerned with appropriate translation into Yupik, translating back to English. And so our pace is sort of dictated by the communities in which we work. And I think this will also affect many other tribal providers as well. So we really have to work at the pace that our communities are able to respond. It's just a comment more than a question.
Bernie, it's a comment very well taken. I have to tell you that I totally agree with you, particularly in the translation. I hope that we're able to work with you closely so that we get very accurate translations of the concept, particularly the one that sticks out for me is how do we translate readiness? And so I fully look forward to working with you. We've done 15 CRAs in Alaska, and that was always the benefit was when we had people that were fluent, when people that understood the language. Sometimes we didn't always have that luxury, and we had to take the time to, slow down so that when we set a 30-minute interview, we had to do different ways of making that culturally appropriate so that there was a time to translate the questions, there was time for people to talk about them, and then the way we gathered the answers. So I really thank you for that comment today. I can't agree with you more about the opportunity that we have, in Native Connection, and we have all those lessons that we can bring forward and help you with.
Yeah, a related issue, which I think is absolutely critical, is the preparation time to gain the trust of the community that will allow us to work collaboratively.
Well, that's where we can talk about trust, and that's why we have you, Bernie. We're here to help empower as much as we can, but we're reliant on people that are from the communities, and if it takes you longer to build that trust, and we don't get the CRA until much later, I've dealt with many of those issues, and we're open to working with you on a case-by-case basis and sensitive to all of the barriers that might present itself. But, our goal is to help to get the CRAs completed as soon as possible, because when those scores are available to you, you make it allows you to develop a plan that is realistic, that matches, the community, and allows you to really see the progress that you might be able to accomplish in this first year.
Good. What we'll do, I think, is keep our project officer aware of our internal timelines.
Sure.
That way everybody's cognizant of what's happening.
Great.
Gary comments on this topic in the chat box, saying that translating the 9 levels of readiness into language each community understands and responds to is critical as well. Deborah, did you have a comment on that question?
No, I agree with what's been said. That is going to be very important. To move at the speed of each community. What they're ready for, and some of this, this will need to be translated into languages that the communities will understand. So I really thank you for bringing this topic up.
We have a final question from the chat box from Yuki Trails. How will we coordinate and how will we communicate with our partner community?
I think I can answer that one. We're going to be setting up monthly phone calls or monthly conference calls with Angela and Melissa. Oh, Michelle. Sorry. We're going to be setting those calls up here real soon, and at that time, we can talk a little bit more about how we're going to be doing that.
Thank you. We are almost at the end of our time today. we had mentioned that this slide deck will be made available over email. So for folks on the phone, if you think that we don't have your email address, for example, if you're not a primary point of contact for your community, could you please type your email into the chat box right now, and we'll just draw from that list and add it to the email list when we send out the copy of the slides that you've seen today. So please go ahead, type your email into the chat box, and we'll send that out to everyone. And this is Josephine here, and as we wrap up, I just want to thank everyone for attending today's webinar. To thank you on behalf of SAMHSA and all your coordinators with Native Connections. Just a reminder, please join us again on December 17th for the third part of our 6-part CRA training series. We will be discussing the first step of the implementation process, that is identifying your community's issues. Also, I'd like to remind everyone that following today's webinar, you will be receiving a follow-up technological assessment survey. This is really important to us in terms of gathering information on how you receive some of this information and how it's also disseminated to your community. Please take 10 minutes to fill it out, and if possible, to complete the survey before Friday, December 5th. Again, this concludes today's webinar. Thank you for attending, and have a great rest of your